Hi guys, it's your next nurse Florence and you're welcome back to my channel where we talk all about health and wellness. In today's video, we're going to be talking about type 1 diabetes mellitus. We're going to be talking about what it is, its signs and symptoms, its causes, the risk factors, its prevention and management. Don't go away. Type 1 diabetes mellitus, also called insulin-dependent or ketosis-prone, is an autoimmune disease. Here, the immune system of the individual attacks and destroys the beta cells in the pancreas where insulin is produced. This leaves the individual with little or no insulin. So instead of glucose or sugar being transported into the cells, it builds up in the bloodstream. About 10% of people with diabetes mellitus have type 1. The exact cause is unknown, but it is thought to be caused by a combination of genetic susceptibility and environmental factors. Factors that may signal an increased risk in type 1 DM includes family history, if a parent or sibling has it, environmental factors, such as exposure to viral illness, which likely plays some roles in this type of DM. The presence of damaging immune system cells, that is, autoantibodies. Sometimes, family members of individuals with type 1 DM are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 DM, but not everyone who has these autoantibodies develop DM. How can you tell that you have type 1 diabetes? Or what are the signs and symptoms of type 1 diabetes mellitus? The symptoms include unintentional weight loss, vision changes, excessive excretion of urine, increased thirst, fatigue or tiredness. Children with type 1 diabetes mellitus may start wetting the bed after they have been toilet trained, and these children should be treated promptly without delay. Note that these symptoms occur suddenly. Type 1 diabetes mellitus cannot be prevented. However, healthy lifestyle choices could help control the blood glucose level. These healthy lifestyles include 1. Be physically active. Do at least 30 minutes of moderate regular exercise. 2. Eat healthy diets. Cut down on refined carbohydrates and sweets. Eat more fruits, vegetables, whole grains, and lean proteins. 3. Avoid tobacco use because it increases the risk of cardiovascular disease. 4. Drink more water instead of other beverages or carbonated drinks. 5. Avoid sedentary behaviors like excessive sitting, which has been shown to reduce the risk of DM. The most important management of type 1 diabetes mellitus is insulin injections or the use of insulin pumps. There are 4 major types of insulin. We have the rapid acting, the short acting, the intermediate acting, and the long acting. Other management involves frequent blood glucose checks, carbohydrate or calorie counting. The most common complication of type 1 diabetes mellitus is diabetic ketoacidosis, that's increased ketones in the urine. This is as a result of cells being starved of energy, so the body then begins to break down fat. This breakdown produces toxic acids known as ketones. Diabetic ketoacidosis, or DKA, is caused by acute viral upper respiratory infection, too much food, not enough medication, in this case insulin, or exercise. The symptoms of DKA include loss of appetite as a result of nausea, vomiting, fever, weakness, ketones in the blood, stomach pain, dehydration, that's hot, flushed and dry skin, and acetone breath, that's sweet fruity breath. When these signs and symptoms are noticed, you should seek medical help immediately without delay. Other complications include coronary artery diseases, heart attack, stroke, blindness, kidney failure, impotence, and amputations. It is important to note that when individuals with diabetes mellitus are sick, their blood glucose goes up, so they need to take their insulin even when they are not eating. So guys, if you like this video and you want more health and wellness tips, hit the like button because it does a lot of good for me. Please subscribe to my channel Click on the bell icon so you'll be the first to know when I upload new videos. Please drop your comments in the comment section below and I'll attend to them. I remain your next door nurse and I'm just a knock away. I love you guys. See you in my next video. Bye.